This is Dr. Scott Hopper from Rood Riddle Equine Hospital with today's Rood Riddle Vet Check on the Kenny Rice Horse Racing Show. Today, with the Kentucky Derby coming up, one area we thought we'd discuss are soft tissue injuries that we see in racehorses that are common. The most common racehorse injuries that we see are bowed tendons are probably by far the number one problem, followed by suspensory ligament problems, both proximal suspensories and suspensory branch problems. Lastly, the things the soft tissue injury we see are what's called sesamoidal ligament injuries, which are three major ligaments that run from the base of their fetlock down the back of their pastern. The typical signs of these are lameness is what the horse shows us. We can detect some of these things by heat or swelling, but lameness is our first tip-off that there's something going on. And this is commonly picked up by palpation of the horse's leg. Then obviously we'll use ultrasound to diagnose a soft tissue injury as opposed to radiographs, which diagnose bone problems. The effect on these racehorses can vary considerably. If a horse bows a tendon at this time of year before the Derby, he'll be out. Same with if they tear a suspensory or a sesamoidal ligament. Those horses will not be rehabbed in time because they'll need time off and therefore will miss the Derby. If they have a more mild problem or more like a sprain or a strain that you or I might get, you may sprain your ankle or whatever, all you're doing is you're straining a ligament in your ankle. Well, horses strain their suspensories. And so some of those can be treated with anti-inflammatories. Sometimes we locally inject them with anti-inflammatories, ice, cold hose them, and shockwave therapy can be done to try to get these things to heal and quiet down and still continue the horses in racing. But for the most part, if a horse gets a moderate injury to a soft tissue, rest is the biggest part of it, and those horses will be out for a few months, if not longer, depending. The average horse that bows a tendon, they don't see their first race for about 10 months. So that pretty much will shoot their 3-year-old year. So obviously they're trying to catch these things early to keep these horses on the Derby Trail and the Triple Crown Trail here through the summer during their 3-year-old year. There's other treatments that we do for these things if they are more significant, such as stem cell therapy, PRP. There's numerous other things that people have done to treat them. But those are horses that will be laid up and will unfortunately miss all the big races coming up this year. If a horse gets one of these major injuries, it does not mean that it's the end of their racing career. It may mean that they miss the bulk of their 3-year-old year, but many of them can come back and perform at the same level that they have been. Some will drop a grade in class depending on the severity of their injury, but it's not the end of their racing career. We've had great success with stem cell therapy, shockwave therapy to treat a lot of these problems and to get the horses back to racing. So hopefully this has been somewhat of an informative segment, and I'd like to thank everyone for tuning in to this week's Rood Riddle Vet Check, only here on the Kenny Rice Horse Racing Show.